And Tom Emmons was maybe you've heard the name. The Emmons families are old-time Medford residents. And his father, J.J. Emmons, started an ophthalmology practice here way back in the 20s. Then Tom was Dr. Swan's first resident way back in the residency program at the UO. And Tom ended up with cataracts himself. So he was down here by himself and kind of dropped out of the surgical scene and needed somebody to come down, and I just happened to be the one. So I was anxious to get out of Portland, and anyway, so I came down and joined Tom Emmons, and it was just the two of us, and we were in the Fleur building downtown, which burned down. It was on the corner of Main and Central. Then we moved out to East Main, and a year later, not quite a year later, Tom died. He choked on a piece of meat at a football game in Eugene. And so here I was, I mean, shortly, just kind of a eager young boy, sort of out of school, and taking over the practice. And I had one optician and probably 2 or 3 people helping, and that was on East Main. The practice has been really ongoing, not under the same name, but since the 1920s, which is a long time.
It is.
Nonstop. And
so one of the things that I remember when I started there is that you and Dr. Retzlaff were known for being so progressive, in ophthalmology, that you were the first to do phakial emulsification. How did that happen?
I got to tell you a little story. I was, frankly, in my younger days, I was very aggressive and very competitive. I took no prisoners, and as a result of that, sometimes you don't make a lot of friends. Sometimes you do, but I knew exactly what I wanted to do and when I wanted to do it, and I wasn't about to be sidetracked. But we were doing the old intracapsular cataract extraction, which, as everybody knows by now, was a large incision. You took the whole lens out, ended up with cataract glasses. And our cataract population at that time was small because you had to wait till people's vision was around 2100 before you could operate on them, and it was hard to operate on one eye because then they had one eye with aphakic and one eye normal, so it was a whole different scene. Not only that, when you found somebody that needed surgery, that's my doorbell. You not only had to talk them into surgery, you had to get a medical clearance, and then you had to go out and find money to pay for it. And that was before Medicare.
Oh, wow.
We charged $300 for a cataract operation and $50 for the assistant. But financing at that time was virtually, I'd say maybe 2 out of 10 people at that time really could afford to pay $300 plus the hospital. So basically you became a social worker. Cataract population was totally different then, because wearing cataract glasses was no fun. And sometimes you had what you thought was a perfect result, and they were wearing the thick cataract glasses and were miserable. And so you kind of had to crank that into the formula. But and so one day I was taking care of a bartender in town, and I think he was in the old Jackson Hotel or somewhere, knew everybody, had cataracts, and I had him all ready to go. He had posterior subcapsular cataracts, and he really needed surgery. Got him all ready to go, and he was gone. He left town. About 2 weeks later, he came back and had both eyes operated on, in San Francisco. And he tapped me on the shoulder. He said, "John, you better get along with this." He went down. He had phacoemulsification by Gil Cleesby at Stanford, and happy as could be, small incision, and that was all I needed. And this guy had a big mouth, and everybody that went in nothing worse than a bartender. Everybody came to the bar and needed cataracts. He told them. So I mean, it was word of mouth. It didn't take me that long. So I quickly signed on to Dr. Kelman's course. I took it with Bob Sinski in Santa Monica. Went right down, talked the hospital into buying everything because we had nothing. We didn't even have microsurgery.
Wow.
So we had to start with a microscope and all the units, the whole thing. So I stuck my neck out by a long ways, and when I came back, I had to do it. And Rexloff and I was by myself, but I was sort of a little more aggressive than John, and so I basically taught myself.
Wow.
And I would go down to Santa Monica every couple of weeks. I'd take off and go everywhere just to learn one little thing at a time. Wow. Spent some time with Dick Kratz, who was a big name, and Bob Sinski. And we got to be friends. Well, that gave us a big head start. And the medical school, that was I'm rambling, I hope.
No, this is great.
Okay. It was a godsend to have him come because we shared everything. We were good friends, and we, along with being partners, and it just filled in. And at that moment, we started to grow. And our office was too small. We always did sell glasses, which put me at ends because the pure people at the medical school, you weren't supposed to be commercial and sell glasses. That was not very respectable. But I mean, I figure if I wanted to sell glasses, I was going to sell glasses. It was just that simple. I mean, and one of the pearls I picked up from there was, like I said, you had a scrap for cataracts. Didn't just walk in the office, believe me. You had a scramble. There was another guy in town, Don Smeezing, who was very competitive, and we didn't get along very well either, but that's okay. And so if you wanted to do the most and have the most surgery, you had to do something different. And
so was that your idea then to do the bands?
So because obviously I wanted to work Klamath Falls and the coast and Wairika and those places, and so that was one way we do it. But
so, what are you most proud about Medical Eye Center and your kind of career there?
I think I'm just proud of the tremendous service that, as a group, not me, but Retzloff, me, and the rest of them, gave to the whole community. And it was a quality eye care. I mean, the same care they could have gotten anywhere in the country. And we knew our limitations, but up to that point, we did it here, and the patients got a good break. We took good care of our patients, and we filled a big gap in the medical community. We always, Patty, had the nicest group of people working for us. I mean, I'm not sure I can think of anybody. Maybe, I'm sure there was somebody, but we all got along, and I thought of everybody as my friends rather than as they were. I guess they were employees, but I didn't look at it that way. And we had a good time together, and I think that's probably the other thing I'm proudest of. It's just what a nice group of people I spent my life working with. Both Dr. Imperia and Dr. Weisel, both personally and for what they've done.
Yeah. Is there anything else that you think would be important for the new staff at Medical Eye Center to know about the history of the place or your career?
Well, just to let you know how important your role really is. Because the patient's going to go away with maybe spent more time with you than they spent with the doctor. And I've been there enough to know how very nice you are to people. And you're going to have patients that are disagreeable and are dissatisfied, and those are difficult to deal with. And if you don't think you can deal with it, get somebody that can. And but if you find somebody that's tired of waiting or unhappy, tell the doctor. There used to be an old rule, a 20-minute rule. Anybody that waits over 20 minutes is going to be unhappy. And if you want to build, and in all due respect, people younger getting out of school don't fully appreciate that. They haven't been there long enough to know how important these little things are to people, and just to be nice to them and to not keep them waiting. And if they got to keep them waiting, for God's sake, tell them so. And that is so important.
Appreciate
it. I can say you folks run a very, very nice operation. And